Welcome to another episode of our Keep It Simple series where we talk about common urological problems. My name is Dr. Jay Lim, and today we'll be talking about nocturia. Funnily enough, this is a topic that was actually requested by my very own mother, who after watching some of the previous videos realizes that she needs to wake up in the middle of the night to go to the toilet. This condition is called nocturia, and according to the International Continence Society, this is defined as the need to wake up from sleep to go to the toilet to void, and the voiding is followed by going back to sleep or at least the intention of going back to sleep again. So with this definition, the void that we do just before we go to bed each night is definitely not counted, or is the first morning void that a lot of us do as well. Why is this condition important? Primarily because I've seen some patients who basically are affected by so much prior that they wake up 5, 6, 7, 8 times in the middle of the night. Naturally, over the long run, these would cause a lot of issues during the day. For example, tiredness, lack of concentration, cardiovascular issues, and increases your comorbidities for other conditions as well. It can also mean previously undiagnosed conditions like uncontrolled diabetes or obstructive sleep apnea, or otherwise known as snoring in the middle of the night. As with most of our previous videos, today we will be going a bit about the overview of this condition, how do we diagnose it, what are the treatments available, and the various complications that comes with treatment. So let's get straight into it.
I purposely chosen a fairly bright background for today's topic of nocturia. For those patients who suffer from this condition, one of the most disturbing things is the fact that you do not have good quality sleep and you wake up the following day feeling more tired, unable to concentrate. It is important then to know that if you do truly have this condition, with the right amount of treatment and lifestyle modification, it is entirely possible you will wake up the following morning feeling bright and sunny like the background that we have here. So for today's topic, we will be covering essentially on what is nocturia and how do you actually go around recognizing it. When you understand it, then we will then need some little tools that we will be introducing today that I use to help you figure out whether you indeed have this condition as well. Finally, we will wrap up this topic with the available treatments out there and the lifestyle modification that can be useful in controlling and living with this condition. Not all episodes of waking up in the middle of the night to pass urine should be considered as nocturia. The International Continence Society, in their 2018 definition of nocturia, states nocturia is waking up to pass urine during the main sleep period. So for those of us that likes to void before we go to bed, it actually does not count as nocturia. Similarly, if you have trouble falling asleep, if you were thinking of something else, or you had a bit of disturbance in the environment, you couldn't sleep, you wake up, you go to the toilet, that does not count because true nocturia needs to be preceded by sleep. After you void, you had every intention to go back to sleep. Another situation that nocturia is commonly mistaken for is the morning void that a lot of us practice when we wake up to go to start the day. Because that episode we do not have any intention of going back to sleep, voiding early in the morning does not count as nocturia as well. When a patient presents to me with issues of going to the toilet more at night, it is important to find out what's the underlying cause, and there are three major causes as to why that can happen. The first cause is called global polyuria. Now, that is a situation when you are actually making more urine throughout the whole day and not just at night. One of the most common cause for this condition is diabetes mellitus, is where your blood sugar in your bloodstream is very, very high, causing you to be very thirsty. You drink more water, and as a result, you go to the toilet more often. Now, diabetes insipidus is also another condition. It's actually a fairly rare disorder that causes the body to make more urine than it should. And as a result, patients need to go to the toilet more and they have thirst. And it's important to understand that diabetes insipidus is a fairly rare condition, and I will usually require the help of my endocrinology colleagues to make this diagnosis. True nocturnal polyuria is a situation whereby you are really making more urine only at night. And there are some common causes, although they are fairly rarely diagnosed correctly, and that is when you have obstructive sleep apnea. And this is a condition whereby patients actually have snoring, and the snoring actually causes a increase in the airway pressure that dilates the heart on the right side, causing a patient to store more urine, to store more water during the day, which only gets released at night. Other common causes of nocturnal polyuria includes heart failure, whereby you have a weak heart that is not strong enough to pump out excess fluid during the day. It accumulates in the lower limbs and it only clears out at night when you're lying flat. Now, the final category as to why you're making more urine could actually not be a case of increased urine production, but rather an issue with the storage room for urine, which is the bladder. Yeah, a bladder issue, for example, can be caused by a big prostate like BPH. It causes a bladder to store more urine, accumulate more urine because urine cannot be voided fully after each void due to a large prostate blocking the exit path. For the ladies, common cause of storage issue can be overactive bladder. This condition occurs when the bladder does not store as much urine as it should before it tells the brain it needs to go to the urine, but instead prematurely triggers the brain to say, I need to go to the toilet a lot earlier than expected. Other causes that can cause storage issues include stone or urinary tract infection, or external compression like pregnancy can be reason as to why you have the impression that you're making more urine specifically at night. So now that we clarify what exactly constitute nocturia, the next question will be, how do I find out whether I do have this condition? For patients who sees me, we will naturally start out with a detailed medical history talking about your urinary conditions, your urinary history, and this will be followed by, in my case, I would like to do a very detailed fluid intake that a patient takes during a normal day. And not just the amount of fluid that you take, I will also go into details like the type of fluid that you take, how much coffee, how much tea do you drink in a day, what time do you take, and specifically, is it very close to the sleeping hours. This will be followed by a sleep history whereby I look into your sleeping habits and explore a bit more details about your sleep cycle, the sleep hygiene that you practice, so as to be able to help me figure out what exactly is causing you to wake up more frequently at night. Physical examination and bladder diary are two important components in my workup for nocturia. Physical examinations can actually point to me certain conditions that the patients might be having that can cause increased urine productions at night. For example, patients with a weak heart, like heart failure, the heart is weakened to the extent that they are unable to pump out excess fluid during the day. As a result of gravity, excess fluids accumulates at the lower limbs, and if you were to examine patients with heart failure, you will find that they have a condition called pitting edema. It essentially means that a lot of fluids accumulated at the ankle regions, and that could be a reason as to why they make more urine at night, because as the patient lies flat down, the fluid shifts back into the pelvis region, is reabsorbed into the bloodstream, comes out through the kidney as excess urine, and as a result, they go to the toilet more at night. Other conditions like obstructive sleep apnea also have telltale signs that you can find out from physical examination. These patients usually have a fairly thick neck. They might be very breathless when they speak during the consult, or they might even doze off while talking to me because of the chronic lack of sleep. And signs like this may point to the reason as to why they make more urine at night. Another important component is the bladder diary, which you see on the right hand side, or otherwise known as a frequency void chart. This is a chart that is completed over a period of 72 hours. What I request for patients with these void chart is that they use a measuring cylinder to measure not just the amount of fluid that they take in, but also the type and the timing of when they take fluid in. At the same time, a separate measuring cylinder is used to measure the total amount of urine that they make and the timing that they void. Now, it can be a very, very prohibitive exercise to do over 72-hour period, I beg your pardon, but it's important as a more complete frequency void chart will actually help me in figuring out the cause of your problems. In situations whereby lifestyle modifications are inadequate to controlling your nocturia, medications can also play a role. The type of medications that I can give will depend on what is exactly the cause, or rather the biggest contributing cause to your symptoms. Like I mentioned, should it be a cause of a weak heart, medications like diuretics, which acts to make you pee more during the day, can be given based on specific timings to help reduce the amount of excess fluid that you have in the limbs just before you go to bed. If overactive bladder is the cause of your concerns, antimuscarinic medications have been around for quite some time. These can be useful to help control your symptoms for patients with overactive bladder. For true nocturnal polyuria, desmopressins are a kind of medications that replaces the antidiuretic hormones that is normally produced in the human brain, and can help concentrate urine at night so as to reduce the amount of times that you need to go to the toilet. And for men with big prostate issues, then essentially you would require treatments that solves the enlarged prostate. And for this, I've already done another separate video that is available on YouTube under my channel, and I'll urge you to look at that video should prostate be a cause of you having to wake up many times in the middle of the night.
So, as you can see, nocturia may be a common condition that occurs to us or the loved ones around us, and it can have some severe consequences if not recognized in the early stage. Not everything can be related due to aging issues, and it's important to find out whether there are some conditions that are separate and can, more importantly, be treated without too much of a hassle. As usual, this video is best suited for patients who have seen me before, and this video allows you to have a revision of what we've discussed. This also allows me to cover more of the things that might be difficult to talk to you in a video as well. Should you have some of the above conditions that we talked about today, it is important to seek help from your personal doctor or urologist to understand a bit more what might be troubling you instead. Till the next time, bye!